So we're now going to turn to someone who's with the administration. That is Linda Douglas. And obviously a lot going on in the health reform question. So, Linda, let's get right to it here. First of all, obviously the president has said that this is a priority. But how much is he sort of willing to give up in terms of the legislation that ends up passing? Is he happy with anything as long as this gets done?
Well, you know, let's talk about the historic achievement that we're about to embark upon here. Let's look at what's actually in this bill. What we're talking about is lowering insurance and health insurance costs and health costs for all Americans, extending coverage to 33 million uninsured Americans. And by the way, that's a pool of Americans that keeps rotating. You know, in the next decade, half of all Americans under the age of 65 may find themselves without any health insurance at a certain point. So people rotate through this pool of 33 million Americans who will now have access to affordable health insurance, great consumer protections against the insurance industry. They can no longer deny you coverage because you have a pre-existing condition. They can't limit what you spend per year or per your lifetime on health insurance coverage. We're going to require the insurance companies to spend a substantial portion of the money that you pay them on your care.
Linda?
We're going to restrict what they can spend on advertising and profits and salaries. This is a huge victory for consumers.
Linda, though, I have to ask you, a lot of insurers have said that they are going to pass on some of those higher costs for themselves onto premiums for individuals. So, I mean, what's your response to that? What effect will that have?
Well, let me reiterate again that there will be restrictions on what insurance companies can spend on profits and overhead. They've got to spend 85% of the money they get on your care. So there's going to be tremendous restrictions on what they can spend on their advertising or their profits or their salaries for their CEOs. In addition to that, before the insurance exchange goes into effect, that's going to be the marketplace where people who are buying on the individual market or work for small companies will be able to shop for affordable coverage. Before that goes into effect, if insurance companies want to jack up their rates, there's going to be penalties waiting for them. They may be barred from participating in that insurance exchange at all. So there's going to be a lot of restrictions on what insurance companies can do.